Okay, everybody. Today I'll talk about the joints. First, we'll see the classification of joints. How we classify the joints of the body. Then we'll talk about the most common type joint, which is the synovial joint. So we'll talk about the properties of synovial joint. Then we'll talk about different types of movement of the body parts. Then we'll talk about a couple of large synovial joints and see their structures, like knee joint, shoulder joint. What are the joints? Joints are the locations where two or more bones articulate or unite. Is it clear? So, where two or more bones join together or articulate or unite. So, therefore, joints are also known as articulations. Another name of joint is articulation. Now, joints are the locations where we move our body parts. You all know that, right? Without joints, you cannot move the body part. And joints hold the bones together. In this skeleton, the joints are holding the bones together to form the skeleton. How we classify the joints? We classify the joints in two ways. One is functional classification. Another is structural classification. So, joints are divided or classified in two ways: functional classification and structural classification. Functional depends on the amount of movement, how much movement occurs in that joint. Is it clear? So, there are three types functional. SAD, if you remember, SAD, okay? Synarthrosis, amphiarthrosis, and diarthrosis. Okay? If I say cis, S-I-S, that indicates one joint. When we say S-E-S, that means plural. Synarthrosis, immovable joints, where no movement occurs. Can anybody give an example? In which joint no movement occurs? Yeah, very good. I told you in last class, remember, only movable joint is here, right? Temporomandibular joint. All other joints in your skull are fixed, like sutures. Where the cranial bones join, right? Fixed, no movement. So, no movement, synarthrosis. Immovable. Small amount of movement in amphiarthrosis. Good example, you know, when you breathe, your ribs move, right? But not too much, like little bit movement, right? So, slight movement. And diarthrosis, plenty of movement. Lot of movement is possible in diarthrosis. Shoulder joint, right? I can move a lot. Elbow joint, knee joint, right? Hip joint, lot of movement is possible. So that process. So that's the functional. Structural classification based on the structure holding the bones together. Okay? In between the bones, what kind of a structure is there? Make sense? That is structural. It does not depend on the movement. So structural could be two types, fibrous and cartilaginous. Sorry, three types, fibrous, cartilaginous, and another type is synovial. So fibrous is one type, cartilaginous and synovial. Okay, so those are three types of structure. Then fibrous could be three types. Fibrous could be three types, and cartilaginous two types. So let's see what are three types of fibers: sutures, syndesmosis, and gomphoses. So sutures, syndesmosis, and gomphoses. Those are three types of what? Fibrous. Its name is telling you, in fibrous, the bones are attached by the fibers, connective tissue fibers. Make sense? That's why those are called fibers, connective tissue fibers. Sutures you already know. In the skull, right? You have sutures. What happens in sutures, if you see, this is the edge of the bone. This is one bone, for example, parietal bone. This is another parietal bone. They go like this, interlock. Another parietal bone is here, okay? And you see the bones are attached like this. But in between the bones, if you see under microscope, this area, this joint, you'll see many short fibers are here. Many short fibers. So that's why this belongs to fibers. Okay, one type of fibers. Then syndesmosis. Syndesmosis are the joints where the bones are connected by ligaments. Ligaments are formed by fibers, long fibers. So syndesmosis, ligaments connect the bones. Make sense? And gomphoses. Gomphoses joints are the joints between the jaw bones and teeth. So teeth articulate with the jaw bones like mandible and maxilla by gomphoses type joint. So those are three types of fibers. Here you see syndesmosis. This is a ligament, okay, connecting the lower end of, this is the tibia and this is the fibula. So lower distal tibiofibular joint is syndesmosis type joint. Make sense? Distal tibiofibular here. Tibia and fibula, you know that. So distal, this is proximal tibiofibular, this is distal tibiofibular. Okay, so you have a ligament here. That's why that is syndesmosis. And gomphoses, you see here, this is a tooth and this is the bony socket in your jawbone, and tooth is attached to the bony socket by this ligament. You need to know this name. This is called periodontal ligament. So in gomphoses, that ligament, which is a fibrous structure, again, hold the tooth and the bony socket together. So those are three types of fibers. Now we'll see cartilaginous. Cartilaginous are two types, synchondrosis and symphysis. Synchondrosis and symphysis. So if you write down this classification, this will be very helpful, right? Okay, in one place you have the whole classification here, okay? So just write it down that I have shown you here. Okay? Makes sense? Now, what is the difference between synchondrosis and symphysis? Both belong to cartilaginous, right? That means what? Cartilage holds the bones together. Make sense? That's why cartilaginous. In synchondrosis, hyaline cartilage hold the bones together. Hyaline type cartilage in synchondrosis. In symphysis, fibrocartilage. So that is the difference. Okay. So if you see the bones are attached together by hyaline cartilage, that is what? Synchondrosis. Is it clear? If you see the bones are attached together by fibrocartilage, that is symphysis. Make sense? So if I ask you the example, this is the first rib, right? First rib is attached to the sternum, hyaline cartilage. This is hyaline cartilage. So this is what? Synchondrosis. Is it clear? You know this is called what? Pubic symphysis. In last class I showed it. Pubic symphysis. Why this is symphysis type joint? Because the cartilage is what type of cartilage? Fibrocartilage. This is also fibrocartilage, intervertebral disc. Okay. So this is what type of joint? Symphysis. So if fibrocartilage, that is symphysis. Fibrocartilage, that is symphysis. If hyaline cartilage, that is synchondrosis. Very simple. That's right. So that is the classification of the joints. Here you see the rib and the sternum. This is synchondrosis. The head part of long bone articulates with the shaft by hyaline cartilage. If you see inside the bone, you will find that. That is also, since hyaline cartilage, that is also called synchondrosis. Pubic symphysis, fibrocartilage. Two hip bones are attached here. Vertebrae are attached by fibrocartilage, intervertebral disc. That's why they belong to symphysis type joints. Now, synovial, this one. Synovial is most common. And also most flexible joints. So synovial joints are the most common as well as what? Most flexible. Those joints you can move a lot, those are synovial joints. Okay, your shoulder joint, your elbow joint, all these are knee joint, all these belong to synovial joint. Okay. Now, in synovial joint, the bones, like this is one bone and this is another bone, the bones are connected by fluid. So no solid structure, but fluid is in between the bones. Make sense? Fluid. And that's why you can move those joints a lot. Make sense? Only fluid. And that fluid is lubricating type fluid called synovial fluid. Okay? It's like slippery. So that's why the synovial joints are most flexible, most movable joints. Okay, and this fluid is called the synovial fluid. Okay. So that's the classification. Synovial could be 7 different types. We don't want to go into that detail. Just know that synovial is the most common, most flexible, and the bones are connected by fluid. In between the bones, you have fluid. Okay. Now, this is a typical synovial joint. If you see the structure of a synovial joint, as I have already mentioned, this is one bone, this is the end of another bone. Okay, so first thing you'll see the end of the bones are covered by hyaline cartilage. So this is hyaline type cartilage, also called articular cartilage. So articular cartilage is a hyaline type cartilage that covers the end of the bones in the joint. Number 1. Number 2, you have what here? Fluid, synovial fluid. Synovial fluid inside, okay, in between the bones, and that space is called synovial cavity. So we can say synovial cavity with synovial fluid in it, and around the joint you have capsule. Articular capsule or joint capsule that wraps the joint like this. Okay. Capsule that covers the joint like this. Okay. And the capsule has 2 layers. Okay, 2 layers in it. So capsule has 2 layers. Outer is the fibrous capsule and inner is the synovial membrane. Okay, so those 2 layers, outer fibrous capsule and inner layer is the synovial membrane. Okay, so these are 2 layers of the articular capsule. Okay, articular capsule. So I am repeating again. The ends of the bones are covered by what type of cartilage? Hyaline, which is also called articular cartilage. Make sense? In between the bones, you have fluid. I mentioned many times already, synovial fluid, right, in the cavity. And the joint is covered by what? Articular capsule, right? Capsule has how many layers? 2. Outer is the fibrous capsule or fibrous layer. Inner is the synovial membrane. Is it clear? Which one protects the joint? Outer one or inner one? What do you think? Outer one. That's common sense, right? And that's why outer one is fibrous. You remember I mentioned that fibrous structures are very strong, tough, right? So the structure that has more fibers, that structure is tougher. Make sense? So outer, makes sense, should be fibrous. Inner is the synovial membrane, this one. And this is the outer fibrous. So inner one has an important function. What is that? Inner synovial membrane secretes synovial fluid into this cavity. So inner synovial membrane secretes the synovial fluid okay, into the cavity. So very important. Okay, so if I ask you, draw and show the parts of a synovial joint, this is the picture you will draw for this one, okay? Whatever you like, probably will like my one. Okay. Anyway, so you just, make sure you practice this. In some large synovial joints, not in all synovial joints, in large synovial joints, we see another structure that is called a bursa. Bursa are fluid-filled flattened sacs. So bursa are like flat fluid-filled membranous sacs filled with fluid. So flattened fluid-filled membranous, this is the membrane sacs. Okay, that's the bursa. Now, why in large synovial joints you have those fluid-filled sacs? Those fluid-filled structures, bursa, they roll like this and help in the movement. For example, this is a bone or ligament and this is a bone, and in between you have that, this is the bursa, okay? So this is one bone, this is another bone, okay? And when we move the bone, the bursa will roll like this in between, okay? Like ball bearing. So the balls will roll like this in between two structures. So that will increase what? The mobility, movement, okay? Increase the movement.
So like action figures.
Exactly. And also reduces the friction, okay? So, very helpful. Now, sometimes what can happen, the bursa, inflammation, if you move some joint, excessive movement, too much, okay? Like if somebody plays golf every day, like you move the joints a lot, right? Too much. That can cause bursitis. Itis is inflammation, right? Inflammation of bursa is called bursitis. Okay? And that could be very painful. So bursitis is the inflammation of bursa, a clinical condition in which the movement will be very painful and restricted movement. The amount of movement will be less. Here is a good example of a bursa. This bursa is located here. See? In between these two bones. Here. Okay? And when you move your shoulder joint, the humerus, this bursa will roll like this. Okay? Now, this bursa is called subacromial bursa. Sub means what?
Up.
Sub.
Up.
Below, right? Sub, below. And this is the acromion. You remember the part of the scapula acromion? So that's why it is called subacromial bursa. Okay? So this is just an example. We have bursa, a number of bursa in knee joint and the other joints too. Okay? If something hits your joint very strongly, that can rupture the bursa too, right? That will restrict the movement. Now, we'll talk about movement. We know that we move the body parts or bones at the joints. Now, movement occurs due to the contraction and relaxation of the muscles. So we know that muscles move the bones at the joints. This is one sentence. Muscles move the bones where? At the joints. Okay? We know that. Now, this is one bone. this is another bone, okay, and this is a muscle. Okay, so like this. This is your arm, this is forearm, right? The muscles going from the arm to the forearm like this. Make sense? Now, you see, I'm moving my forearm towards my arm. Make sense? So, which bones are moving? The forearm bones are moving towards the arm, right? This one is fixed. And these are moving towards this. Is it clear? So, the end of the muscle in the fixed bone is called the origin, and the end at the bone that is moving, that is called the insertion. So this is the muscle, look at me, this is the muscle. So this end is what? Origin, because this is attached to the fixed bone, right? And this end is called the insertion because it is attached to the bone that are moving. Is it clear? So now I can say that insertion moves towards the origin because this end is moving, right? Towards this one. So insertion moves towards what? The origin. Okay. So this is the origin because this is the fixed bone, and this is the bone moving. So this is the insertion. Okay. So TI, insertion. Okay. So insertion moves towards the origin. Now movement occurs in three planes: transverse plane, frontal plane, and sagittal plane. I explained that in your lab part on day 1. Now, which direction is this? Sagittal. Sagittal, right? Remember sagittal suture here? So this way is sagittal. Make sense? So now you look at me. I am moving my head. Sagittal. Make sense? This way. Sagittal plane. Now, this is frontal or coronal plane. Okay? So, if I move in this plane like this, this is frontal plane movement. Make sense? This way. Transverse is along the ground like this. Okay? If I move something like parallel to the ground, that is transverse or horizontal. So this is transverse plane movement. Make sense? So this is what? Sagittal. This one? Frontal. Make sense? This way, right? And this is transverse or horizontal. Okay? So those are three planes of movement. Now look at my body. Okay? So this is what? Sagittal. Make sense? So now I am moving my upper part of my body in sagittal plane. Make sense? And if I move like this, frontal. Clear? And rotation, transverse. Okay? So those are main planes of movement. Some movements are the combination of two. Those are complex. Okay. Now, those are the planes of movement. Now we'll talk about different types of movements in synovial joints. Gliding. If you see the two bones and both have flat surfaces, like this is one bone, this surface is what? Flat. This is another bone, this surface is flat. Make sense? So two flat surfaces, the bones move like this. Make sense? So that is called gliding. Like this. This is one bone, flat surface. This is another bone, flat surface. Moving like this. Okay? So that is gliding movement. Clear? That happens mostly in between the carpal bones. Here. Okay? Slight movement like this. Angular movements, where the size of the angle between the bones changes. That's why they are called what? Angular. Look at me. I'm moving my forearm, okay? This is the angle here, and you watch the angle. It is getting what? Is smaller or bigger?
Smaller.
Smaller, right? So this is called flexion. Okay? Now I'm moving in opposite direction. Now angle is getting what? Bigger. That is extension. Okay, so those are angular movements, right? Another type of angular movement. Look at my armpit area. This angle is getting what?
Bigger.
Bigger, right? That means I'm moving my body part away, sideways, away, right? That is called what? Abduction. Have you heard the word abducted? I think all of you know, right? Child was abducted. That means what? Taken away. Okay. So now I am moving my arm away from my body. Make sense? So the angle is getting bigger. That is abduction. Now bringing closer again, that is opposite of that, adduction. Is it clear? So adduction, abduction, adduction. Okay. Look at my leg. This is what?
Up there.
Abduction, right? This is adduction. Okay. Here, look at my neck, this area. This angle is getting what?
Smaller.
Smaller. So this is flexion of my head. Make sense? Now getting back, extension of my head. Clear? Now, after I finish extension, this is the anatomical position, right? If you ask me to move further behind, I can do that, right? So going beyond extension, that is called hyperextension. So look again, this is what? Flexion, right? This is extension, going back to anatomical position. Now further, that is called what? Hyperextension. Okay, beyond extension. Some joints we can do hyperextension, not in all joints. Look at my elbow again. This is what? Flexion of my forearm, right? This is my extension. I cannot do anymore, right? So we cannot do hyperextension in this one, okay? Now look at my upper part of the body. This is flexion, okay? This is what? Extension. This is anatomical position, right? Anatomical position. This is what? Hyperextension. Make sense? Okay. Circumduction. Circumduction is circular movement. Like, look at me, I'm drawing a circle, right? When I do that, the movement occurs in my shoulder, that is called circumduction. So, circular movement occurs by circumduction. Have you seen, you all know baseball, right? Did you see cricket, another game? Have you heard that? Cricket?
This is an indeed.
Yeah, in cricket, you cannot throw like this. You have to circumduct, you know, do circumduction, like circle, make circle, then throw the ball, okay? So that is big circumduction. This is a smaller circumduction. That is big circumduction, right? Okay. So, now, rotation. In rotation, the axis of the bone is not changed. So look at this. This is the axis. If I think this is the axis, this is the part moving. So this is called rotation. Make sense? Now, the axis is not changing. Look at this. The movement is occurring, keeping the axis same, right? So this is rotation. If I put something through my head and move my head around it, it will stay like this. The axis will stay like this. So moving around the axis without changing the axis, that is rotation. Okay? Now if I move like this is what? Is it rotation? Axis is not changing. Circumduction. Make sense? So this is circumduction, circle, and this is rotation. Okay? Got it? This is what? Rotation. And this is circumduction. Okay? So they are different. Special movements. In some synovial joints, we have special movements. For example, supination, pronation. they are opposite to each other. Remember, this position, if I put my hand like this position is called supine. This is supine, okay? And moving from supine to opposite, that movement is called pronation. Now going back to supine position, that is called supination, okay? So where we are ending, that is the movement, okay? So this is what? Pronation. And going back to supine, that is supination. Is it clear? Now, if you see these two bones, radius and ulna, in supine position, they are side by side like this. You see, this is radius, this is ulna, okay? When we do pronation, what happens? The radius crosses over the ulna. You see, this end is going to the other end, right? But this end is still there. So it's like this, okay? So in pronation, the bones cross over the radius over the ulna. Dorsiflexion, plantar flexion of foot. Now, to understand that, you need to know this surface, sole of the foot is called what? Plantar surface. Okay? This is plantar. And this top part of the foot is called dorsal. So this is what? Plantar, and this is dorsal. Now, if I move this way towards dorsal surface, right? Upwards, that is dorsiflexion. If I move towards the sole, downwards, that is plantar flexion. Now you tell me, if I stand on my heel like this is what? Dorsiflexion. Make sense? Because this is the dorsal surface, right? I'm moving up. If I stand on my toes, plantar flexion, plantar surface, plantar flexion. Make sense? So those are two special movement too occur in the foot. Inversion, eversion. Inversion, if you move your foot like this, look at this, this is your foot. If you move like this, inwards, that is called inversion. Like this, outwards, eversion. Okay? So, inversion, remember, inwards.
Inside.
Inversion. Okay? Like this. So, this is your foot. If you move like this, big toe up, that is inversion. Make sense? Big toe down, that is what? Eversion, outwards. Okay? So, those are the movements in the foot. Protraction, retraction. Have you heard the word protruded mandible? Probably not. Yes? Anybody? You'll see some people have mandible pushed forward like this, right? So that is called protruded mandible. Yes? Mandible.
An underbite.
Yeah, underbite, yeah. Like this.
That would be overbite.
On an overbite.
No, that is overbite.
It is underbite. It was the under first. Overbite is when.
Whatever. Okay. So that is the protrusion, pushed outwards. Okay. Protruded mandible. If you don't know, have you heard the word retraction? Sometimes we say we retracted soldiers from the battlefield.
Take away.
Yeah.
Back.
Pulling back, right?
Pulling back.
Yeah. So if you push your mandible outwards, that is called protraction. If you pull it backwards, that is called what? Retraction. You know these words. Many of these words you have heard, right? We retracted that person, or we retracted the soldiers. Okay. So elevation, depression. Now look at my mandible. If I open my mouth, if you open your mouth, that is depression, right? You are moving the depression, moving the mandible downwards. Elevation is moving up. So opening mouth is the depression of mandible, because that is the only bone moves, right? And moving up is elevation. Okay? So those are different movements occur in the synovial joints. Okay? gliding two flat surfaces, carpal bones, okay, like this. Flexion, extension, hyperextension, this. Okay. Abduction, adduction, circumduction, rotation. This is supination, pronation. In pronation, radius goes over the ulna. In supination, they go back side by side. Dorsiflexion, plantar flexion, standing on the heel, standing on the toes. Inversion, toe is up, you see, so moving like this, inwards, and inversion opposite. Protraction, retraction, elevation, depression. Make sense? Okay, so those are different types of movements. Now, large synovial joints. These are some large synovial joints in your body. Lot of movement is possible. Knee joint, elbow joint, shoulder joint, hip joint. Those are big synovial joints. I'll just go over a couple of those joints to show you the structures inside those joints. Knee joint is the most complex joint in the body, and it is the largest joint in the body too. Why this is called the most complex joint? You see here, this is the knee joint, you already know. Which bones are here? The upper bone is the femur, right? This one. And lower bones are tibia, fibula, as well as patella. So all these bones together are forming the knee joint. Make sense? Therefore, you have 3 joints inside the knee joint. Within one joint, you have how many joints? 3 joints. You know, these are called the condyles. So, tibia and femur. Femur above and tibia below. These 2 condyles form 2 separate joints here on tibia. Lateral and medial tibio-femoral joints, named by the bones. And another joint is formed by the patella and the femur. Okay, femoropatellar joint. So you see that within one joint you have 3 joints. Femoropatellar, that means the femur and patella, and 2 tibio-femoral joints, lateral and medial. If you see this synovial joint, of course, you have all the properties of a synovial joint that I showed you a few minutes ago. The ends of the bones are covered by what type of cartilage? Anybody? Hyaline, called articular cartilage. Remember that? Okay. And in between, you have the cavity, synovial cavity. Make sense? And that cavity contains what? Synovial fluid. Make sense? So those things should be here because this is a large synovial joint. So you see the articular hyaline cartilage, you see the synovial cavity, and you have fluid here, synovial fluid. The joint is covered by what? Capsule. Capsule has how many layers? 2. Good. Outer is fibrous, right? And inner is synovial membrane. Remember that? Okay. Protection is the function of which one? Outer fibrous, right? And secretion of fluid? Inner synovial membrane. So you should have those things. So you see the articular capsule around, okay? And now, this is a large synovial joint and it has few bursa. You see these green structures are flattened fluid-filled sacs, bursa. And above the patella, you have a large bursa that is called suprapatellar bursa. It makes sense. Supra means above, right? So So above the patella, suprapatellar bursa. Below the patella, you have infrapatellar bursa. So suprapatellar, infrapatellar. And this one is under the skin. You see this is the skin. So that's why called subcutaneous prepatellar bursa. Subcutaneous, that means under the skin, right? Prepatellar, before you hit the patella. So just under the skin. So all those make sense, names, right? Inside the knee joint, you have cruciate ligaments, two cruciate ligaments, anterior and posterior cruciate ligaments. Sometimes turning of cruciate ligament happens. You will hear the term turned cruciate ligament. So those are the main structures. Those are expected in a synovial joint. Around the knee joint, you have few structures.